Um, I'm also mostly excited to have Cassandra join us, and you'll get to hear from her in a little bit. But first of all, welcome everyone. Thank you all for joining our second conversation of 2024. I'm not exactly sure what's happened to the first half of the year, but I'm excited to be here today. I'm Ann Gaish. I'm the CEO here at FamilyWise, and I'm happy to have the chance to share news and updates with you today. At our last conversation, FamilyWise was preparing for the Child Abuse Prevention Month, which is in April. As the Minnesota chapter of Prevent Child Abuse America, FamilyWise works hard to raise awareness about the role each of us plays in keeping families safe and strong, not just in April, but year-round. As part of Child Abuse Prevention Month, we published our third annual Family Wellbeing Index, a report that highlights how Minnesota families are doing using statewide data and stories from our staff, partners, and participants. I'm excited that today we have Cassandra Berg, our Senior Evaluation Analyst and the primary researcher for this publication, with us to share more about the report, and we'll get to that in a few minutes. We also celebrated the individuals and organizations that are creating supportive communities for families through awards, including a Pinwheel for Prevention Award for organizations working on prevention. We awarded our Champion for Children Awards for individuals working in this area. And then for an organization that's leading in innovation, we awarded the Burn Campbell Innovation Award. I encourage you to read all about our incredible awardees on our website blog. And lastly, thanks to everyone that joined us in April for the fundraiser for family well-being. We had a great turnout of over 120 people. It was a really fun evening with games and prizes, and we raised over $18,000 in support of our mission. We are excited to grow the event and all of our CAP Month activities in 2025. And speaking of growth, FamilyWise has been growing our staff and our board. In recent months, we've added a new clinical supervisor, a full-time database coordinator, welcome Stephen, who I think is on this call, a senior wraparound facilitator, and 2 new managers in our parent support services department. This added capacity will make it possible for us to partner with more families and will strengthen the support infrastructure for our staff team. And last month, we added 2 new members to our board of directors. These new members bring lived experience navigating child welfare systems and utilizing family support services. We're excited to have their voice on our board, ensuring that parents have strong connections with their children is such a powerful and a huge asset for FamilyWise, and they bring that to this work. And then, believe it or not, earlier this week we held our annual Growing Resilient Communities Gathering. This event brought together over 200 individuals from across the state to share information and resources for building self-healing communities. This year, the free virtual conference celebrated the stories of change makers across Minnesota that are leading efforts to address problems that affect the health and well-being of their community members. The event's keynote speakers included Dr. Joanne Reichert and Donna LaChapelle from the Center for Mind-Body Medicine, who presented on Earth, Empowering All Relatives to Heal. A full event recap will be available on our website blog next week. Their work was so inspiring, and I hope you have the chance to check in and see what they talked about. We'd like to offer special thanks to our partners, the Minnesota Department of Human Services and the Center for Prevention at Blue Cross Blue Shield of Minnesota, without whom this event wouldn't be possible. And next week, FamilyWise staff will come together for the second in a series of 4 conversations digging into the results of our 2023 equity audit and our goals for integrating diversity, equity, and inclusion priorities at every level of our organization. The equity audit was conducted in partnership with Embracing Equity and sponsored by the Greater Twin Cities United Way's 80 by 3 initiative. We are so grateful for this opportunity, and the audit has already provided us with valuable information about how staff feel about DEI, which is the diversity, equity, and inclusion, in the context of our organizational culture and systems. Our training manager and childcare manager have been internal leads on this project, working with Embracing Equity to interpret survey results and develop action steps. We will build on this intentional DEI work in our staff retreat in September, where longtime partner Dave Ellis will facilitate a training on worldview intelligence. Because collaboration is at the heart of all our work, we value and want to equip staff with skills for listening, understanding, and building on the strengths of our partners, whether that partner is a coworker, a family, or a community. And next month, FamilyWise is launching a new effort to help families better access and utilize the follow-along program. The follow-along program helps parents support and track their child's development through age 3. The Minnesota Department of Health is currently redesigning the program to ensure it is equitable, accessible, and meets the needs of families. As a community connector, we will engage the families we partner with in the redesign process, ensuring that parent voice informs the new design of the program. This is so important because we know that early intervention is critical when a child is experiencing developmental lags in their milestones. And frankly, if you're not around children every day, you may not know what to look for. As one parent told us, he said, when I first started working with a parenting coach at FamilyWise, I learned about the importance of my interaction with my child for my child's development in all areas, especially developing our relationship, attachment, and developing his language skills. As an example, I learned that language development in infants and toddlers at an early age can create a foundation for children to do well in school and to succeed in life. And because of that knowledge, I was able to utilize specific strategies to help strengthen my son's language development. I only learned these techniques to help promote my child's language development through the parent coaching program at FamilyWise. Recently, he attended a parent-teacher conference at his son's school, and he reported that the teacher said, "My son's language skills were off the charts." He said, the teacher said he also regularly surprised her with his vocabulary and his language skills. And as this parent said, as he had trouble learning to read and speak as a child, he was delighted to hear about his son's language development. All families should have access to this kind of information, and we're excited to partner with the Minnesota Department of Health to make it more accessible. The Follow Along Program Redesign Project is just one way that FamilyWise lifts up the voices of families to inform systems change. We also train parent leaders as advocates for families, and we survey our participants about their policy priorities and incorporate what we learn into our advocacy efforts. Here to talk more about our advocacy efforts, particularly through our annual Family Wellbeing Index report, is our Senior Evaluation Analyst, Cassandra Berg. Welcome, Cassandra.
Hi.
Could you start by telling us about the purpose of the Family Wellbeing Index?
Sure. So the purpose of the Family Wellbeing Index is we put it out every year in April. We've done this for 3 years in honor of Child Abuse Prevention Month. So the Family Wellbeing Index looks at factors that help families thrive, from system level supports such as safe and stable housing, affordable healthcare, and high quality childcare, to support from friends, family, and community. So the information and data visualizations are gathered from large scale government, state, and local data sets. And we've especially been doing this over the past 3 years, supplementing it by stories from directly impacted people. So we, as well as our staff and partners. So we want to do more than just reflect back this data. We also want to connect it to the impacted people and to the folks that we know are doing work in the community. And finally, we conclude it with calls to action for how individuals and communities can support family well-being.
Can you tell us, so you talked a little bit about stories and that we use stories in addition to kind of the statewide data.
Yep.
What do stories tell us that quantitative data can't?
Well, I think that when we're looking at data, we're always, whether it's quantitative data, call it like qualitative data, or something just anecdotal with stories, I think that we're getting pieces of the picture and trying to make inferences. And so, you can see a beautiful graph that tells you something about population level data. I think that the stories are what fill in where data is non-existent. So we have certain cases where when we're looking at the more kind of like informal supports and general like social community connections, we don't actually have good population level data for that, but tells us how families are doing. So one, it can fill in where the quantitative data is missing. Two, it can really provide kind of color and context to fill in details and make connections so that people can better understand the data. And I think a really good example of that we use in the Family Wellbeing Index is we talk quite a bit about childcare and about what the childcare landscape is in Minnesota right now. And we try to illustrate that in a few different ways. So there's the quantitative side where we know that childcare is considered affordable if a family is spending no less than 7% of their income on childcare. We can look at population level data and see that it's something like, I think 90 to 98% of families who have young children of childcare age do not have enough income to meet that affordable threshold. So we can see regardless of who you are not getting affordable childcare in Minnesota. But another layer of that is we talked to Sarah, who is somebody who is currently she is receiving high quality childcare right now. And the reason she's doing it is because she is able to enroll in childcare assistance. She was able to receive childcare assistance. But the only reason she was able to receive childcare assistance is because she was in a domestic violence shelter. And she tells us she basically, we sat in a room with her and we have the data to back up all the horrible things about the current childcare landscape that I will say in the past couple of legislative sessions, there have been great strides in increasing access, increasing scholarships, and basically making different policy tweaks to allow more folks to be able to access childcare. But we sat in a room with Sarah, and Sarah wanted to share her story, and she wanted to tell us about the fact that now she has childcare, but with her 12-year-old, she was working full time and assumed she would be able to have childcare. Assumed she would. She was like, I'm a person who is working full time. I should be able to send my child and be able to trust the care that they're getting while I am at work. And that was not the case. She had to cobble together just friends and family. And at times her child went to work with her. And so her older child didn't get the benefit of this really high quality early education that would help prepare that child for entering school. And because her situation got dire enough with her later children, she was able to jump the wait list and get childcare. And she, told us how she loves it, and she loves the care that her children are getting. And it's precarious because if she ends up, currently she's on MFIP, which is Minnesota Family Investment Program, and that which is Minnesota's version of welfare. And if she ends up, either she can work too few hours, too many hours, and suddenly her childcare is gone, and she still is not making enough money to afford a childcare center. So I think that, we can look at this data and make connections to our own lives. I know I certainly did. I did the math about about my childcare and looked at the averages for like across the population. But I think that hearing other stories can help fill out the different situations and help us make different connections.
That's such a great way of framing it up. And I mean, Sarah's story was so powerful. I think it was, it added so much like nuance and complexity to the discussion. And I think, you know, this idea of cobbling together these resources, well, it's nice when you're able to call upon your natural supports to help you out when maybe your kids are tired and you still have to run to the grocery store. But you can't, like, you may not have resources to do that and have them help you fill in for your childcare all the time. And so it just puts more and more stress and strain on families. And I think Sarah's story illustrates that in a way that makes it so real, and so clear for everyone. Are there other key takeaways from the Family Wellbeing Index?
Yes. So I also wanted to highlight, I think that we do a really nice I think we do a really nice job in our section about mental health. So basically in a single page, we're showing really dramatic data. So one, that if we look at the Minnesota Student Survey, which is a great resource in Minnesota, where kids of a certain age every year are asked these questions, and it is almost statewide and an amazing data set. But anyway, it's done every 3 years, and we can see on a chart, we can see on a graph that starting in 2013, youth, I believe it's like, I was going to pull it up, but I believe it's like 18% of youth are reporting that they're experiencing severe mental health issues. We can see over 10 years, with the last year being, was that 2022? We see a stepwise increase, so that by 2022, it's 28%, over a quarter of youth are, and like a very strong increase are reporting severe mental health issues. So we're one, seeing this really dramatic graph. Two, we're adding that we're adding that the household, so the US Census also has a household pulse survey that reports on adults, and that we're seeing a similar increase in adults. And we're seeing the faces of the two staff that we interviewed, who are directly working with youth and families who are experiencing these mental health challenges, and some of the barriers that they've had for accessing care. So we're really in a single page, seeing just a lot of different context around that issue. And it connects to policy as well, because we have our staff who are saying, like, you know, we have seen this severe increase in challenges, and we're seeing that people are not able to navigate the system and get into care without wait times or different complexity that is difficult to navigate when you're in crisis. And we have the kind of policy information where we know that currently Minnesota's Medicaid rates do not reimburse the full cost of care for mental health. So we both see like an almost exponentially increasing problem, and we're seeing that we're not even investing enough to pay for it for people who have public medical assistance. So the bottleneck is very clear in that case.
And I think we know that that there aren't enough mental health resources across the state, that there are deserts where it's very hard to access that kind of care. So then when you add the complexity on in the, like even in, for example, the Twin Cities metro area, families are grappling with waiting lists and being able to get into providers. And there's more of an abundance of resources here, and it's still not enough. So I think that's a really important takeaway for us to think about, and to think about all of those ways of how we support families that are grappling with these issues, whether it's trying to help them connect to care or just trying to help them find support as they work through these issues. I know we wanted the Family Wellbeing Index to tell the story of what's working for families in Minnesota and to show their strengths, but it's been hard to find that kind of data. What would you like to see change in the field of evaluation to better tell that story?
Yeah, so it is very hard to it is hard to look at to present stories of family well-being and to always be strengths-based about it. I know that we want to try, we want to have a positive framing, we want to show what's right in communities. I would say that that is one side, but also, we can't ignore that, there are things that are structurally not right, and folks are not being, are not equitably receiving or experiencing the same benefits. And and it is hard because we do want to show what's right, but but we also want to be, honest and realistic, because accurately showing what's happening is what's going to lead to action. And so, one thing I see, you can, I'm looking at this slide and you can just barely see. So we have the rate of insurance for folks in Minnesota varies by race and ethnicity. And when folks, the column or the graph below, we have that we have it broken down by who can the percentage of folks who delay care due to cost. So we see that or I can see, you probably can't, that people whose race or ethnicity is Hispanic have a lower rate of being insured, and they have a higher likelihood by quite a lot of delaying care when they need it due to cost. So this was data from last year, and actually we see that this happens because people who are Hispanic in Minnesota have a higher likelihood of being non-citizens. And because of this data, there actually was legislative change where Minnesota Care now is going to be offered to non-citizens. And so this is something where we see an issue is impacting a community differently. And there are specific legislative mechanisms that can help it.
That's great. That's it's exciting to hear that, and exciting to see how data connects to action and how we can use data to truly make change, to make things better for families. So thank you. As always, Cassandra, you are such a wealth of information and such so knowledgeable. It's amazing. I do want to take a few minutes if anybody has any questions, either about the Family Wellbeing Index or anything else that we brought up today, to give our audience a chance to ask them. Yes, John.
I'm interested to know if there'd be a way to annually or biannually poll the participants in Circle of Parents support groups around the state. We need evidence-based information to support grants for Circle of Parents, and that would give you a lot of stories, I'm sure, from people who are the population that you're talking about here in these graphs. So it's just a thought that comes to mind in hearing Cassandra's presentation.
John, that is great timing. I know that you're active in Circle of Parents, and we do have the currently it's Circle of Parents participants are being tracked in Circle Stats that we do compile annually, but we're actually going to revamp that whole system. So please be in touch, because we're actually shortly going to be asking for your feedback on that.
And thank you, John, because I agree. I mean, that's what we've heard from Circle of Parents participants in the past has been so powerful and so moving. And so it is a priority for us to look at how can we provide those kind of annual or biannual, some type of regular ongoing evaluation, because if the voices of parents are huge, and that's a great way to kind of lift up those voices. So thank you for that. Any other questions or comments? Right. Well, thank you everyone again for joining today. We really appreciate you being here. Thanks again to Cassandra. We are so fortunate to have such a depth of expertise on our team. And we look forward to seeing you at our next quarterly CEO call. Thank you.
Thanks, everyone.